Recording in progress.
Complete the table with the words from C opposite. Put a stress mark in front of the stressed syllable in each word. The first one has been done for you. Noun, adjective. Exhaustion, exhausted. Fatigue, fatigue, fatigue. Lethargy, lethargy. Tiredness, tired. Make word combinations using a word from each box. Look at A, B, and C opposite to help you. Complain of color, out of sorts, present with, put on, worn out. Complete the sentences with the correct form of the verb present. A 67-year-old man presented with a 9-month history of increasing shortness of breath. The most common presentation is loss of consciousness. Cranial arteries may present as fever without any obvious causes. The patient usually presents with a severe sore throat. The presenting symptoms in the patient could perhaps be due to renal failure. Other conditions with a similar presentations include acute colitis. Reduced growth is an important presenting complaint of celiac disease. 2 months following presentations, the patient was able to walk. Read the patient's description of her symptoms, then complete the case report. Look at the opposite to help you. I was well until a few months ago. In the beginning, I just felt off color and a bit tired, but lately I've been feeling completely worn out at the end of the day. I'm not eating any more than usual, but I've put on 9 kilos in the last year. My emotions are hard and my hair has started to fall out. Case 13, a 60-year-old housewife who had been well until 4 months previously complained of tiredness and malaise. She had gained 9 kilos in weight in the year before she presented to her GP, although she denied eating more than usual. She was constipated and she noticed that her hair had started to fall out. Find words in the box with opposite meaning. Adequate, inadequate. Against, for. Unlikely, likely. Severe, mild. Rare, common. Insidious, sudden. Make word combinations using a word from each box. Bone marrow differential diagnosis, insidious onset, iron deficiency, pernicious, anemia, progressively increasing, vibration sense. Complete the sentences. A 39-year-old man presented with a history of progressive abdominal distension over a period of 6 months. Blindness may be caused by vitamin A deficiency. The bleeding and purpura are caused by an abnormal palpable function. By abnormal platelet function, not palpable. Was an error. The white cell count is normal, so we can exclude acute leukemia. The yellow color of her skin and conjunctive is probably due to jaundice. There was a palpable mass in the right upper quadrant of the abdomen. Treatment and aimment are restoring fluid balance with adequate intravenous fluids. The anemia may be due to increased red cell breakdown. Complete the conversation. Professor, what is against the diagnosis of pernicious anemia on physical examination? The problem started quite suddenly. So it didn't have the typical insidious onset. It doesn't have any skin pallor, and it doesn't have symmetrical paresthesia or absent vibration sense. And I couldn't feel his spleen. What about his tongue? His tongue was normal and not inflamed or sore. Skull, jawbone, breastbone, rib, thigh bone, kneecap, shin bone, spine, this is collarbone, shoulder blade, spine, match the type of fractures. Open, there is a break in the skin open. The bone is bent. It occurs mainly in children. Green stick. The bone is broken into several pieces. Community. The broken pieces are separated, displaced. The broken pieces are pushed together, impacted. Complete the textbook extract. Reducing. Fracture involved trying to return the bones to as near to their original position as possible. If a fracture is allowed to heal in a displaced position, the fracture will unite, but it may go on to malunion. Complete the table with words from A and C opposite. Bear. Delay, delay, delay. Develop, development, develop. Distant, distinction, extended. Fail, failure, failed. Notice, nourishment, nourished. Babies with the fetal alcohol syndrome may present with failure to thrive. Abdominal distension may be due to an enlarged liver. Small amounts of alcohol in pregnancy can affect fetal development. Mortality from measles can be reduced by better nutrition. Delay in one or more of the milestones may be the first sign of disease. Complete the sentences. After sitting, babies learn to crawl and then to walk. A child who has started eating solid food has been witnessed. Someone who is not very tall is said to be of short stature. The stage in a child's development are known as the milestones. A child who is beginning to develop sexually has reached puberty. Write the common English name for each disease using your medical knowledge. Enlarged parotid glands, mumps, difficult opening the mouth, lockjaw, rash and enlarged posterior occipital nodes, German measles. Paroxysmal cough with vomiting, whooping cough, pupils and vesicles, first on drunk cheek and bugs. Cough and cold followed by rash, millets. Sore throat and rash, scalp fever, swollen joints and hard murmur, rheumatic fever followed a muscle weakness, polio, cough with a stridor cough.